Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
My guest today is Ralph Sanchez, the author of The Diabetic Brain and Alzheimer's Disease and the Improved Mind Diet. These two books came to fruition through not only an extensive research focus by Ralph, but also a journey to save his brain and heal his life. Ralph, we need to talk about this because you're not alone in this, and you know that. But let's talk about your two books. They are the offspring of your quest to prevent dementia for yourself, and they include a journey over 2 decades of intensive research regarding the risk factors and the related causes of Alzheimer's disease. Ralph has had at least 2 more books published on this subject because it's such an important subject and one that shows how you can possibly apply to your own risk for cognitive decline and dementia as you age so that you can take control of your life. So, Ralph, I want to welcome you again to the Susan Brender Show, and I'm so delighted that you're here to talk about things that impact people in so many different ways. Now, why don't you start from this? You said that you were very concerned about your own journey because so many things happened in your life. Let's talk about that and give my audience an idea of what happened.
Thank you, Susan. So grateful for you and making time for this show. As a matter of fact, we have a series of shows planned, correct? And
Correct.
It's all going to be around educating and sharing the science of Alzheimer's disease and how people can look to reduce their risk and prevent it, which is really important. It's a very exciting field, and I am so looking forward to sharing that information with you and the listeners of this series. So yes, I came to the realization well over 20 years ago. This was in the 90s. I was in practice and really immersed in the research around various health disorders, but I had my own problems. And I was trying to figure them out. And as I was putting 2 and 2 together, I realized that a severe exposure to pesticides and a very, very severe concussion, head trauma that I had incurred many years ago when I was a young man in an auto accident. And I had also been diagnosed with what's called a mercury body burden, which means that there's a lot of mercury in your body. And if there's a lot of mercury in your body, there could be a lot of mercury in your brain too. And we know that mercury is very neurotoxic. And so are pesticides. Pesticides are very neurotoxic. And one of the things that really started to alert me about the potential for my own brain health in regard to these exposures was seeing research in the literature around the exposure to pesticides and the increased risk for Parkinson's. And as I dug in and looked at the related science, I started to see lots of information regarding Alzheimer's disease and the link to pesticides and the link to mercury and the link to brain trauma.
Yeah, I had to just interrupt for a second to ask you about mercury and about some of the other things that you talked about, pesticides, for example. And there's been a lot of controversy over that. So you're suggesting that there was evidence-based science behind the relationship between dementia and mercury and also pesticides. Is that correct?
Yes, but let me clarify something that you said regarding a controversy. Now, especially as far as mercury, the research community has not come out and said that mercury causes Alzheimer's disease. but it is a risk factor. So there are many things that are associated with a disease process, but for one reason or another, the community has not come out definitively and said, well, this causes Alzheimer's disease. And it's good to put that in a context as such, because there's way too much hype floating around the news reports and social media about various causes of Alzheimer's disease, like infections, such as herpes, or other infections that are associated again with Alzheimer's disease. Or
Right.
in the case of metals, there's been the link of aluminum,
Mhm.
and none of these have been definitively categorized as cause,
Yeah.
but they are linked to Alzheimer's disease as a risk factor. In other words, you could have a problem associated with these risk factors that eventually starts to affect your brain and contributes to a disease process that is akin to Alzheimer's disease or another neurological disease like Parkinson's.
Right.
So that science is very clear. There's a lot of research on that, and I have videos on those topics at my website, thealzheimerssolution.com. So it's a great place to go and get some information that's reliable. I was influenced by a researcher out of I forgot what university in the South, but he did a lot of research and a lot of campaigning on alerting people on the link between mercury and Alzheimer's disease.
And what did he come up with?
Oh, there's just so much science, So he was one of many people that I became aware of many years ago when I was doing my research. And there's also a lot of progressive people in the dental community that were sounding the alarm bells about dental amalgams and the mercury in dental amalgams and the link to neurological disease. Now, we know there is no question that mercury and pesticides are neurotoxic, okay? So if something is neurotoxic, no matter what it is a risk factor for a neurological disease like Alzheimer's disease.
Right.
We just can't say that in any one individual it caused it, but there are some very, very strong associations.
I'm going to interrupt you again. I'm sorry about that, but
Okay.
Proteins. People talk about proteins as one of the leading causes of dementia, that there is something that perhaps is in your diet or is not in your diet or is associated in some way with the notion that there is this particular protein that really causes it. Can you tell our audience about that?
Well, yes. I was planning on getting to that on this show or subsequent shows, which we can elaborate more on that because it's a fascinating field of research in terms of what happens in the brain, and that's what you're talking about. It's about proteins that are referred to as amyloid protein, and there's another one called tau protein. But before we go there, I want to clarify a few things, and I wanted to make sure that we had a base of information so that when we refer to these terms that we understand what we're talking about in terms of Alzheimer's or another neurological disease or a dementia, okay? So
Sure.
Alzheimer's refers to characteristic problems in the brain that are aligned with a disease process. And that disease process can lead to dementia, okay? But there are many other causes of dementia, and Alzheimer's disease is considered to be the leading cause of dementia. So it's important to understand that, because you can have Alzheimer's disease, and this is a very important point that we'll be elaborating on, but you can have Alzheimer's disease and not have dementia, because the Alzheimer's disease process can span 20, 30 years or more. And during that time, in the very beginning stages, there are no signs, there are no symptoms of Alzheimer's disease. It's a silent disease when it first begins. And then you morph into another stage. So that first stage is called preclinical. Preclinical stands for there's no clinical signs or symptoms. Okay, so you're in the preclinical stage, in the very, very early stages of Alzheimer's. And then as the disease process progresses, you go into some cognitive decline, and that's when it's beginning to be noticeable. And that's called mild cognitive impairment. And there's an acronym for it called MCI. So in mild cognitive impairment is when people are starting to notice, or their family or loved ones are starting to notice, that there's some issues with memory, there's some issues with thinking and planning and clarity and being able to execute things around their planning and thinking around their life and what they need to do to maintain a normal life. And, mild cognitive impairment can span several years, and it could be a milder form in the beginning. You can be perfectly normal in terms of your function, but you may be noticing little things that don't seem to be normal compared to what you once were. And then as it progresses, it gets more severe. And a lot of times that is the stage where people, if they're really proactive, go to their doctor and start to look at what could be the problem.
Ralph, just 1 second. Average person who is growing older find that there is a certain degree of memory loss, there is a certain degree of cognitive changes, and things that are going on in their brain and also physically that is just normal. And how do we identify the difference in a person who is really on, an early onset dementia, as opposed to somebody who is just getting older, and as they used to call them, they would say, well, they're senile, something of that nature.
Right.
Because people are frightened. They're very frightened of this. I would say, and you probably could elaborate on this, but for the most part, there are people who, as they grow older, their families notice the changes, but aren't these changes just normal sometimes?
That's a very interesting topic, and let's put it this way. More severe cognitive decline or senility, and at one time, these issues were referred to as senile impairment or cognitive aging, and they were considered to be normal. But we now know that it's not so normal. Why is it that some people in their 80s and 90s and even older are in great cognitive shape? Their brains are functioning normally, and others are not. Okay, so you can maintain a very sharp mental and cognitive acuity into a ripe old age. And is it normal to have some decline? So what I was going to get into is that there are many other factors that can contribute besides the disease process, right? But there are other factors that can contribute to a cognitive decline that is considered to be normal, and it is correctable. Okay, so yeah. Now they're referred to as reversible dementias or reversible cognitive decline states. Okay, and these states be issues related to hormones. Now, one of the shows that I would like to plan with you in this series, because we're planning to do at least 7, if not more shows regarding all of the different aspects of Alzheimer's disease and the science of prevention. But a very important one for women is estrogen, okay? And an important one for men is testosterone. So as those hormones decline in aging, it can set you up for cognitive decline. And those issues are correctable. As a matter of fact, there have been many cases of a diagnosis of dementia that eventually were correctable through various therapies, whether it was hormones or B12 therapy and other nutritional therapies. There's a very interesting story that was that's been circulating on the internet quite a bit, and I have a Facebook group, a private Facebook group called Brain Defend, and people can access that through the Alzheimer's Solution Facebook page. But I was asked about this story, and it's a story about a woman who was in severe cognitive decline and was diagnosed with dementia. And the family was advised to, get her on medications that are typical in, dementia diagnosis that they might suspect as an Alzheimer's. And we'll get into the diagnosis, because the diagnosis of Alzheimer's can be pretty difficult and is often misdiagnosed. And these are cases where, there could be a misdiagnosis. There could be normal issues related to cognitive decline, and it could be diagnosed as a dementia. So this woman was in this process of cognitive decline, and she was the family was being told there was nothing that could be done about it, and that they needed to get her on some prescriptions. And so I believe it was her husband that started to, look around for alternative solutions and ran across information around diet. And he got her on a Mediterranean type diet, which focused and the information that he had come across more on fruits and vegetables and other healthy foods, right?
Yeah.
And lo and behold, this woman started to revert to a more cognitive, healthy state. In other words, she was no longer in a dementia state that was previously diagnosed. And her life normalized. And there are a few stories like that, and I want to caution people from thinking that you can reverse a more severe dementia, with nutrition, although you can do a lot to stabilize the decline. Like in the case of my mother, who was diagnosed with a dementia, and one of the things I wanted to get to is that there are other causes, of course, of dementia, which can make the diagnosis very difficult. And the second leading cause of dementia is known to be around what is termed cerebrovascular disease, and that is associated with cardiovascular disease and the impaired blood flow to the brain that starts to progress into a diagnosis of cerebrovascular disease, which is associated with a poor circulation in the brain, which eventually can start to manifest in what are called tranexamic attacks, transemic ischemic attacks, TIAs, and that's when you're not getting enough oxygen into the brain. So it's ischemia, which is referring to the lack of oxygen, the lack of blood flow to the brain. And in some more severe cases, that can be strokes, okay?
Yeah. Excuse me, that's what I was going to ask you, because TIAs seem to be very popular, if you will, and that's a poor word to use, popular, because it's so negative. But TIAs, aren't they like simple strokes, and some people don't even know they have them?
Exactly, so that's the problem. You can be in these disease processes earlier in life, or even later in life, and you don't know that anything is going on. And then more severe issues begin to happen in terms of your cognitive capacity, or you have a major stroke, and then you know you have a big problem. Okay, but a lot of these disease processes around vascular disease and diabetes, which are huge risk factors for stroke, they can be silent in the earlier stages. And people are not taking care of themselves. They're not going to their doctor. They're not in a proactive prevention program around their health and aging. And so a lot of these problems are starting to build up, but they don't know about it until there's a more severe problem that's apparent. And then in those cases, there's a lot more work to be done. But one of the things I wanted to emphasize is that the science has progressed so much in terms of what we can do about these problems, that even when you are starting to notice that you have some problems in terms of, let's say, a mild cognitive impairment, which can be diagnosed, there is some evidence that in some cases that disease process can be reversed. So once you get into mild cognitive impairment and a diagnosis of such, there is still hope for a reversal of the disease process. And getting back to what we're talking about in terms of normal aging versus what's not so normal, there are many other issues related to health problems that could look like a dementia, and they're easily reversible through, say, nutrition or hormone therapy. And there's a very interesting condition that has been shown to be misdiagnosed as a dementia, and it's called normal pressure hydrocephalus, where excess cerebrospinal fluid accumulates in these areas of the brain. They're called brain ventricles. And there are chambers where fluid is sometimes accumulating, and this hydrocephalus can start to look like a dementia or Alzheimer's. And it's an easily treatable condition. And as soon as you treat it, the cognitive decline, or what it looks like a dementia, can be reversed. Several cases of that's been brought up in the literature where people that were diagnosed with such problems were able to reverse their diagnosis.
Well, I'll tell you something, Ralph, and I think that you've provided in our Series 1, and that's what I'm going to call it, Series 1 from the Susan Brender Show, really bringing up the point of what is Alzheimer's disease and what types of dementia exist and things that you can do about it. So this was our first in the series, and Ralph Sanchez, again, is the author of The Diabetic Brain in Alzheimer's Disease and the Improved Mind Diet. These are two books that came to fruition through extensive research. Ralph, in our next show, you're going to start to really get into some of the aspects of Alzheimer's and dementia and how people need to understand more about it. So with that said, I want to thank you for being on our show today, and thank you for offering all the information and education you can to our audience in this Series 1. And I would like you, if you don't mind, to give our audience just a little bit of a tease of what is the next in the series that you think will absolutely blow them away, because when they hear it, they're going to say, I had no idea. Have you any thoughts about what is in the next series?
Absolutely. So, you brought up a very good point. I think it's important to, set up other calls and other shows that we're going to be doing around this series. And, in the first show or two, we're going to be explaining some basic factors. And I want to get more into the proteins that you brought up, the amyloid protein and the tau protein, because it's very, very important that people understand these issues. Let's say that they have a loved one that is in cognitive decline and they go to their doctor and, they're looking at a possible diagnosis, and there may be neuroimaging that's brought up in terms of an assessment tool or other assessment tools, and they'll be looking at the accumulation of these proteins. And so I want to make sure people understand what they are and what they mean in terms of an Alzheimer's disease. So in the next show, we're going to dive more into those characteristic disease issues that are aligned with Alzheimer's disease. And we'll do a little discussion around that for the sake of clarity, and the other shows that will proceed after that. So thank you so much for this show, Susan, and taking the time. And if people want more information about my work and what I do, they can go to the AlzheimersSolution.com. I also have a lifestyle and nutrition program that's built around, the prevention aspects, built on the science of Alzheimer's prevention. And that program is called Brain Defend. And they can get all that information at the AlzheimersSolution.com.
Well, thank you, Ralph, again, for being on the Susan Brender Show and starting the series on this very important topic that people really need to understand more about. Thank you again.
Thank you again, Susan. Look forward to our next one.
You got it.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.